Pongwe. Listen on Pongo FM at 10:30 hours every Wednesday starting on 17th of January 2024. Mufulira, listen on Mafcan FM at 1500 hours every Saturday starting 13th of January 2024. Chingola, listen on iWave Radio and Kokoliko FM at 900 hours every Thursday starting 18th January 2024. Insaka Yawumi, helping us improve our lives for better health.
This message is brought to you by Population Media Center in partnership with Ministry of Health.
All right, good morning once again, and you are still listening to Rooster FM, and the time is 10:06, and this is how we get into our program, which is brought to you by the Population Media Center, and it is a program which is based on health, and today we are discussing a topic which is quite interesting, which is early ANC booking, and I am your host. I'm going to be your host for the next 1 hour, and my name is Mukuka Jackson now, and in the studios today I have Mrs. Asamta Tawanda and Sister Barbara Lutangu. Mrs. Tawanda, good morning and welcome.
Good morning, thank you.
How are you?
I'm very fine, thank you.
Awesome. And Sister Lutangu, how are you?
I'm fine, how are you?
I'm good. And kindly note that this program is also being aired live, not only on Rooster 91.3 FM, but also on Radio Chimwemwe, that is 91.7 FM. So like I said earlier on, it is going to be a phone-in interview, a phone-in program, and we are discussing early ANC booking. So this is in line with maternal and child health, if I am to say it that way. So I would like to find out, I don't know who's going to start between the two of you, but I would like to find out what is ANC booking, and who is supposed to do it. Or maybe we start with what is ANC booking.
Okay. Good morning, thank you, and good morning, listeners. Okay, as you are saying, what is ANC booking? Basically, ANC booking, this is the enrolling of a registering of all pregnant women, regardless whether they are married, they are not married, whether they are adolescents, they have to be enrolled. And in this enrolling, this is where we register our all pregnant women in our antenatal register, and thereafter we provide our clients with an antenatal card which they'll be able to go around with. The antenatal register remains at the facility with adequate information that is gotten from the client. Then the antenatal card goes with the client so that they are able to access antenatal services on appointed dates and whenever necessary. And the person who's supposed to do this antenatal booking, it is a skilled health worker who's supposed to know what type of information they're supposed to get and what physical examination they're supposed to do on this particular client when they are being enrolled.
So since this is done to women, is it only married women and married women, or maybe it's women across the board?
As I mentioned earlier on, it's actually women across the board. Just when they realize that they are pregnant, they're supposed to be enrolled or registered. Yes.
Okay. So why is it important for pregnant women and the unborn child, or when there is early why is it important for pregnant women and the unborn child to have this early booking for ANC?
Okay, thank you very much. Basically, early antenatal booking is very important, as it has been alluded to. But it's very important, as the woman books will be able to do the basic elements, the basic things that we do. I'll give an example. Even during the booking processes, we are able to check vital signs. That is, one of them includes the blood pressure, the temperature, the respirations, the pulse. We are also able to do physical examinations on these women. We are also we also do different tests and investigations, like checking the HB, which is the hemoglobin levels of this woman. We test for HIV, we test for syphilis, hepatitis, we do urine tests. So if you look at these tests and these issues that have been mentioned, it is very key for this woman to book early, because if any abnormality is detected early, it will be able to be treated as early as possible, rather than this woman who books late. The time maybe they are booking, they may have already a known abnormality. Maybe their BP is high without them knowing. So maybe the time they are booking, if they book late, it may be too late, it would have complicated. So the earlier they book, the earlier we are able to detect any abnormality, and it is easy for us to manage the well-being of both the mother and this unborn baby.
So fino mwalanda fe wino sana mukuri bale ambaba abatabali mfwe chisungu nga mapunda ti booking ya wapano pa booking ya finish hemoglobin. So I don't know if you can just try to just a little bit of basic translation into Bemba concerning what you've said, just for the sake of those of us that are not really conversant with the perfect English that you're using.
Okay, thank you very much. Twatotela sana. Twachilana ndapavukankala wakuisa mukulembeshe efumo bwangu. So namayo ngaisa mukulembeshe efumo bwangu fingi fichitika kulya continento. Kula boko pimako obwingi bwa mulopa ukumonanga namayo akweta umulopa washani ngefe twaishiwa omwana pakukula kulafa iko mulopa na pakupapa umulopa umbula fuma. So tulapima obwingi bwa mulopa so that kwabo kumwafuilisha. Tulapima RPR ukumonanga kuliko akaswende na tuishiba bwino ati ububulwede nga twabusanga bwangu kulaba nokubushita treat wangu na mayo ashitashani apola nga kuita na bapatina nabo twabashita treat kulaba nokupima na kashishika HIV ichi kankala na mayo ngalembesha bwangu nga chakutila ati twasanga tina kwata kashishika ka HIV kulaba okumunda pa wangu so that umwana ulya udumala achingirirwa ukwambula akashishika HIV. So chikankala sana ukwebatwa na mayo bale isa mukulembesha amafumo bwangu liya inefe baishi bat balembesha chira twangukila ero chiralenga tina mayo aikala bwino twamunda pa wangu bwangu.
Mkwa iso ngero mwakutika kumulaba sawa Rooster FM 91.3 program tarifa live pa Rooster FM but timwakutika na kuchimwemwe that is 91.7 and ninkwata abarera ndapari early ANC booking antulanda ati ukwamba antinento bwangu abani ba Mrs. Asampta Tawanda na ba Sister Lutango and program it is brought to you by the Population Media Center. So kwadi babali kwa tufimwanda ati ukwamba wangu kwadi wa important kura wambi batampa fe wangu wino ero baisarik nangu batampa de akuya ko maybe bapusa batorokera ila consistency faika ukuya fe as prescribed by health personnel bukankara nshuba wapo wa kula yafe fya family ngakula isa every day ngakula isa every week bukankara nshuba wapo. What is the importance of consistency?
Okay, twatotela sana ngefine balondolwa kwena. It's very important to be consistent in this antenatal. Why it is important, I'm sure you've been able to hear the explanation on the activities that we actually conduct. Na mufefo tuchitadi onse na mayo ngaisa kuli antenatal. Kula befya kuchenchente fingi sana. So necho tuleko selesha pali consistency. Mulanduwa kweba tichiria mwaisa elo mwalembesha. Nimbikuti tuwasanga tifyonse filifye wino lelo mukuya kwanshita pantu ilifumo lile chitashani dine ya lile kula. So tituwasanga tinipali cha chitashani ichaba abnomo efo tufaila nga mwaisa twachenchenta nga pali cha pili buko kufuma munomo bwangu twachitashani twachunda pakweba ati twachita improve the outcome ya umwana na imwe mwebanyina. So consistency yena yali beikankala nga mwamu na filafine bana mayo mweba alembesha pokale tulanda ati chila mwenshi na mayo ofu afila chitashani aisa kuchipatala lelo kwali bana balio batweba ati temwenshi mukalaisa nangu afute milungu ibiri mulandu wako ati mbina tusanga mwakabule makamo oko tulefu atuchiteshani tubombelepo. So consistency bana mayo yali beikankala sana kai tufile tuwakonka kulingana na filafine tulembela pachikadi pakutampa mwachumfana chirondolola kulaba ati ife nga twachita register twami bookinga tulakwata twalemba mu register yesu then kulaba na kakadi kala tuleba ati continental card nako tulalembapo ubushiko bw'omufiiri okubwera leero nangu twalemba buli obushiko bw'omufiiri okubwera nga mwasanga ati paliko akabulema kamo bwangu muli bantungwa mufiire mwaisa bwekera ku kipatala bwangu mukwayo ebukankala bwa consistency tulera ndapo
Sefini mwarondora tinga mwasanga kwa kabulema tumapera kama examples bulema nshobo bengasanga uingalenga ti baisa before them machitire advice okwisa.
Okay, na totela sana mkwaye kula abachidia na mayo eri aisa mkulembesha talelanda pone filifeta pali file kalipa na ngufeka amu leo ni mbia ya afu mafe mkulembesha aya kuunganda asangati umuto ule chitashani ule kalipa so afuile abwela talolele ili ya deti tulembele pakadi afuile abwela bwangu kwisa kuchipatala pakwati tuwache nchenta chinshi chilelenga uyu mutu ukali pakwati nga tuwachisanga bwangu uyu na mayo tuwampela no muti fingi iyo yacho bafe ni example lero fingi fingalenga na mayo ukubwera kuchipatala other than on the appointed date.
So basically what are some of the other services that are available during this ANC that we are talking about?
Okay, so some of the services that are available, there is booking and registration. In the process of booking mukulembesha mulia turasenda history kuli na mayo. We get basic information about this woman. We get the information, her full name, zamashina, the age, eroba fielwe, house number, ekobekala. Then we'll get also obstetric history. Ukuipusha u ask bakwata pa mafumo yanga bushe ifumo ye bakwetelia namba shan, and would also want to ask about the experience in the previous pregnancies. So kula boku ipusha bushe ifumo. We'll give an example ngana maya kweta, that is the 4th pregnancy ngaisa mkulembesha kula boku ipusha ifumo ya namba 1 mwaka nshi elo mwapapire pamyenshinga no kuipusha nefyo mwana afinine. That is very important for us as you to be able to tell us the history if you adina mayo ipefumo. Then turashitako nama investigations ya lekana kula boku pime milopa tulapima kwa kashishika HIV tulapima obwingi bwa mlopa itwati HB tulapima ko hepatitis B tulapima na kaswende which is RPR tulasambirishako nefi alekana ifi akuipekanya the importance of good nutrition fya kulienshi na mayo afuiro kulia ali pabukuru general hygiene ifi akuichenchenta. Then tulasambirisha nyako nama danger signs so that na mayo aba baishiba ama danger signs ifilefi ngachitika efyo na mayo tafuiro kumona ali pabukuru. Example na mayo li pabukuru tafuire kula bleeder alefumo mlopa kunshi. That is a danger sign. So kula bokusambirisha eringa ama danger sign nga BP nga nainina alefumo mlopa alefuma ifya nunka kunshi ifumo likulu tale umfo mwana kusakanya. So all those things are done and they are being taught about. We also do physical examination where tulamwika tana mayo ukumumona bwino ukumona alishani yeo tulelanda nanko twapima pamala busho mwana uli mukati twamwipusha alishani umwana bushale sakanya or anything. So fingi kwene fichitika nga twalembesha twashita register twapima weight twapima BP and fyonse fi twalondolola mkwai.
Walondora wino sana. Then kwali wako for sometimes makombonium. You know, there are those people who will say come watch the register ANC kwa ya fiadila. Is it a must that where you register for ANC is where you must go and deliver from?
Okay, thank you so much. Indeed, we do registration in all our facilities. Kwena kulembesha tulembesha fekonse ababe chipatala le lyokupapila twalikonkomesha ko mlando wakwebati kwadi baya ama facilities yambi ayashafunguluka sana wakwebati nimbina mayo kuti apapila. So na lalo ine tulelembesha twalikwata ama facilities yo tuita tama delivery center. Lelo na yaye no tulelembesha na ina tulakwata kuipekanya in terms of an emergency. kuti twahwesha namaka chakwati twamupapisho yunamayo. So techikankala chakwabati it's a must where you register is where you can deliver from. No, you can deliver from any facility of your choice.
What are some of the common health issues that ANC brings out about pregnant women and the unborn child?
Okay, so you find that mostly the common health issues that antenatal care brings about pregnant women and the unborn child. We'll look at first the medical issues, okay? Kwali banamayo who have maybe already medical conditions even before they become pregnant. I'll give an example. Maybe this woman is already hypertensive. Namayo libina kwata BP la lina, alikwata asthma, alikwata chipumputu. So those are very key as we get the history. And we've seen the most common medical issue that we have, especially hypertension, because you find that there are some women who are not even hypertensive, but once they become pregnant, bakwata BP, eyo tuita muchisungu at pregnancy induced hypertension, mulandu yama hormones yala yefumo. So you find that some women will develop some conditions, medical conditions like hypertension because of the hormones that are present during pregnancy. So that is one of the medical issues, and it's quite common. That's why we always ensure that banamayonga baisa twapima bwino ama BP, whether bad quarter history of BP or tabakwete, because this is something that can be exaggerated during pregnancy. Ngari kwata condition nakare. Then kwali banama surgical issues that ama women bakwata. We'll give an example. Those women maybe who might have delivered through cesarean section, but have a quite operation. So badanabo kula ba okuba change even during booking, and those we usually encourage them to deliver from the hospital. Yes, so that they are well taken care of. And would want to see each and engerati banamaya bapape na operation inishi. Okay, so that we rule out any other causes. It can be possible that ne fumonia na ya konkerepo bimbi, depending na cause each and engerati bapape na operation kuti bapapa na operation na kabili. So if you look at these issues, we look at medical issues, we look at surgical issues, we also basically look at just the general physiological issues that women have, psychological issues, where we counsel women about stress management and other issues.
All right. Okay, so if you are just tuning in, this is Rooster 91.3 FM, and you are listening to a program brought to you by the Population Media Center. And we are not only live on Rooster 91.3, but we are also live on Radio Chumwemu, which is 91.7. So this is a phone-in program. So you can definitely call through using the number 0965 913 913, as well as 0777 770 913. That is 0965 913 913, as well as 0777 770 913. Or you can come through using an SMS, and we shall definitely accommodate you. So my two guests in the studio today, Mrs. Asamta Tawanda and Sister Barbara Lutango, and we're discussing early antenatal care booking. So I think I already have an SMS here. I just want you to tackle this particular one while we wait for callers to call through. So this particular one says, is it okay to register for ANC in either 4 to 5 months from there's no identity?
Okay, thank you very much for that question. Okay, since it's what we are encouraging, I think, as Minister of Health, is for a woman to register as soon as they know they are pregnant. As early, others register as early as 4 weeks, as early as 5 weeks, as soon as they know that they are pregnant. But even if they are late, we still encourage them to come through and register. Because we've seen that maybe some women who may say, I'm already late, so there's no need for me to register. So we also encourage them to come and register, but it's very important for women to register as early as possible, as soon as they know they are pregnant.
Right, so 0965 913 as well as 0777 913. Those are the two numbers. Phone call angula message then to alaiverenga, and if it's a phone call, we'll definitely put you through and you definitely come through with your question for our two guests with regards to what we're talking about, the topic which is early ANC booking. So getting back to the conversation, there has been all these issues of I have to go with my partner for pakuya kuwantinento kuya na abampere fumo nga niba boyfriend nga niba fiancé nga balume. Is it a must that the pregnant woman must go with her partner for ANC?
Okay, thank you so much. Indeed, kwena ukukabila kweso ngaba kuchiputulwa chabumi kuti twakabila sana na mayo olole isa mukulembeshe fumo aisa na bena mwankwena ngo niba partner lelo twalishi bange fine bachirondola kula bali niba boyfriend ni bitali comfortable bonse baja kwena nga baisa tatu batamfye tula bachita accommodate necho tufwaila na mayo ulipa bukulu kwisa na partner wakwe kula bafe na support system ilo ole umfa bwino ole umfa nechipale kwena ngoli na mwina mwobe mwaisa umfila pamo, and there's a lot of information that we give. So mlamu ine tule pela information kuti twasekela boyfriend aba kuchiputula chabu mimwa umfila pamo such that nero mule ya kunganda yafe kwati ndi discussion pantu bonse mwachitashani mwachumfwa pakwe bati nangu ko bombela chapamo mule bombela chapamo pakwe bati nefumo kweno kutanga takwefumo no mwina mobe kwabo kwalondoloka, so that it also improves on the outcome because you have got that ideal and proper support system with you. Lelo ukulembesha bana mayo tekwe batikano mwalolela omwina mwebwe pwati mukese elembesha iyo yena tatutamfya kukabila fye kweso ukwa kwebati chilya muleisa mwaisa na pati na pantu tulakabila mwaufila pamo ama messages na ngupalifya kulondola bena myentu tuwa mwafwako twalondolwela chapamo emkwaye kukabila kweso.
Alright, so 0965 913 913 0965 913 913 as well as 0777 770 913. Those are the two numbers that you can call through or send your SMS, and we shall definitely do as we always do. So when it comes to Ndola district, we would like to find out what is with regards to ANC booking, just how is the situation? Are we below average? Are we average? Are we above average? Are we doing excellently well? What is the picture like when it comes to ANC booking in Ndola?
Okay, thank you so much. And Ndola District Health Office, in terms of antenatal booking in general, we are doing very well. But we are actually at 97%. But our concern is the early antenatal booking. From the earlier conversation, I'm sure mwachumfwa kwa chibeli ipusholo ya kwa tukushe kutunaisa pa 5 months na 6 months. Ukukabila kwesu bana mayo tule kabile chakwa tupali apene fye mwaishi bati namu kwa tefumo below 3 months ikuti tuate mwaisa pakwe bati mwa bookinga nga mwachufa kwenefo tuachilondolola nga tuami bookinga tuamista in row efyo tuchenchenta kwena efingi so tufwaya panapene nga tualembesha mwalembesha bana mayo mwa bookinga shirie milimo shonsosho tuachilondolola kwa bana karaka consistency tuachilondolola pakwa tupalia muleisa chilanshita tule michenchenta because if we continue looking at this early antenatal, okay, it will actually help us.
You can just hold your thought. We pick up this particular call. Hello, good morning. Hello. You're through to Rooster FM.
How many? Hello, boss Mohammed.
Mohammed.
We know the gift model from Northrise up.
Gift model from Northrise. Yes, talk to me.
Concern not for picture. Could for the sake could assist and over the website to Romundum Kazana Dinefu. Sadiva, it's a Suminisho or one for us, a Kadikonsika Kadipa, Uxendum to you without Sugapatara Anwa.
Okay.
Yeah,
all right, thank you so much. All right. Okay, so you can also come through just like a gift from Northrise on 0965 913 913 as well as 0777 770 913. So I think you can continue with your thought, then we shall get to gift.
Okay.
Yeah.
So I continue from what I was saying to say, actually in the antenatal booking in general, we are doing very well. I can say we are at 97% as of fourth quarter. But our concern is the early antenatal booking. Elonga twayeba ati early. Tulefwayo okukabira chakwati banamayo pali apenefe mwaishi bati namukwate efumo. Mufire mwaisa alembesha. And when we say early, it has to be below 13 weeks.
And
below 3 months.
I'll have to cut you again.
Okay.
All right, good morning. Hello? Hello, good morning. Yeah, I'm going Mohammed. Yeah, I'm going. Ishina ngwale to me. Mr. Mpundu Ntwapia, go ahead.
No ine natira foyo kushako bushefi umuntu maya ku clinic mukulembesha kuleba ati ngataukweta ama scanning kwate mo space 3 scanning ngataba kupede yataukwete pakuya mukupapa bushe balera ndati kushupi kwa kulya ku hospital ushapo bala twewa koshana
ati umuntu ngatakwete nshi
amaskani sirianga tabamuku tere kumaskani
tungatere kumaskani when giving birth. Okay. All right, so 0965913913 as well as 0277770913. You can proceed. Hopefully you'll be able to finish your thought.
Yes, I'm just actually winding up on the early antenatal booking. What we are saying to say, our desire is all women to register early so that we are able to detect any deviations from normal so that we be able to improve the outcome. So basically this is our desires in Dollar District Health Office, and we urge every listener be able to try and help us there in the community in identifying of these women that are pregnant, actually to advise them to go and seek medical advice as early as they realize they are pregnant. Thank you so much.
So we had Mr. Gift from Northrise who came through and asked, is it advisable for a woman who is pregnant, whenever they feel, maybe whenever they experience a headache or anything that is making them uncomfortable, to self-prescribe and take medicines minus any health profession's prescription or advice?
Okay.
Basenda fyo mutu since ndio mfo mutu ngani panadol ngani finshi banwa abene.
Thank you so much for that question. Actually, it's not advisable. Every concern, every ailment in these pregnant women, please, we are advising you to go and seek medical advice at a health facility. Because like an example that you have given to say umutwe tamwishi bechile ngomutu oyo panduli minga mu self prescription mwala senda fe panadol munwe lelo ifenga mwaisa kuchipatala mwala sanga tinga twaisa pima twala sanga kutili mbini BP nini elonga yani na idana ngumunwe panadol uli omuntu etawalike but nga mwaisa kuchipatala twami chenche bwino mukasanga ati twampelo omuti ukulingana nefirelenga omuntu okukalipa mkwai. So tuleko nkomesha na mayo uli pabukulu tafwirwa okunwa omuti uli wonse ushilembelwe na bashinganga kuchipatala mkwai.
And Mbundu from Twapia asks, someone who goes to a clinic to give birth and they don't have according to him tabakweta mascan atwala shupikwa you as the people attending to that pregnant person at kula wokushupako what is the situation?
Okay, thank you very much. Twatotela sana Bampundu. Maybe just to come through and answer your question, twalalanda ko pabukankala the importance of doing a scan. Remember, as much as we are doing tulechenche tata tule mono mwana mukati ifile shitika. So we are able as midwives kulabati mlepi mafya bwino but tulashita encourage na mayo ashitako scan kozira tulango mwana efyo ekere nefyo ali twala pera example limbi mwana ilingirine kulaba limbi na ipombo mutoto mumukoshi. So that is something that we cannot see physically, but ngashita scan kulabo okuishi bato omwana oyali mu danger omwana anapiribuka at whatever stage. So scan basically ila twafwa ukumona obumbi bwa mwana bulishani bushe omwana alishani bushe bali babiri nangula balele shani ushokulu wafye fili fyonse ifilelenga batatuleva ati namayo ngatakwete scan kulabo kumutamfya ku kliniki awe bachika nkala tulashita advise that namayo uli pabukulu at least afuira kwata ko scan so that twamona efyo omwana ali ifili mukati twatotera mkwaya.
All right, so you can also, there's an incomplete message here, but I don't think we can respond because it is incomplete, because the part which is incomplete is where the question is. I don't know, whoever sent this particular message, if your number ends with 279, you can just resend your message because it is incomplete, even though it talks about something that has to do with HIV and being drunk whilst pregnant. We do not know exactly what question you're trying to put across. So you can just resend that particular message and we shall be able to get to you. So if you are also listening, this is a radio program brought to you by the Population Media Center. And we are not only broadcasting live on Rooster FM 91.3, but also on Radio Shmwemwe 91.7. And we're discussing early antenatal care booking. So getting back to our conversation. You stated you as in dollar we are at 97% when it comes to ANC booking. Women express. Okay, let's pick up this particular call. Hello. Hello. Yeah, I'm quite more men.
Okay. Nana try
Ishina na kwale tumina. Ishina na kwale tumina.
Na mawa papa basi napa kukora nomba definitely anonga kunshi. Siya ni problem nangu te problemu.
Oh, atwana nishina?
Grace from Masala.
Grace from Masala. All right. All right. So Grace from Masala is asking about discharge, which is smelly after giving birth. Is that a sign of a problem when women start having discharge, which is smelly after giving birth? Okay, we can get this, then we answer them simultaneously. Hello. Yeah, I'm quite Momben. Bananshina?
Wakasaka, Mr. Kasaka here in Ndola.
Mr. Kasaka, yes, go ahead.
My ushe chinchi tare important na mwana kashi no muntu umekuwa antineto because turumva advise sana yako bati bana muringize ukwisana na bena mienu kusipatala kwa antineto so nisichabera very important nangola nisichabera muri ngo kanuna mayo aya no muntu umekulya.
All right. Right, so we can start with Grace, the smelly discharge after giving birth. Okay, let's pick up 4 calls, then we shall answer them all at once. Good morning.
Hello, Mwabomben Kwai.
Mwabomben.
Ernest Mwaya.
Mr. Ernest. Mwenetu minagwisa. Go ahead.
Natrai pishatu tuli bana maya bako bati ifumodiari kula batare no bwalwa nafaka bali peta yansi ko bishomwa na pakya ala basebu no bino.
All right, so you can come through using the number 0965 913 as well as 0777 770 913 and we shall definitely pick up those particular calls. So okay, seems like calls are not coming, so we can get back to Grace. Smelly discharge after giving birth. Is it a sign of something bad?
Okay. Twatotera sana kwena Grace pali pushwelyo. Kwena na mayo nga papa. Kola bero Twitter postnato nga isa twamuchenchenta. Nga chakwe bataya kunganda asanga tipali file nunka. Au kwena file fe abwekera mulandu wako yati file fifuma kuisamba tafifwile okununka nangu pa nono nga fyanunka ba Grace nishipali ubwafya elo ni mobwafu bwafya imoteti mubwishi becho tulenda tumufule mu stashani mwabwekera kuchipatala pakwati twachenchenta ichilerenga okununka pakwati twamipera no mtimu kwayo okununka kwa file fuma kuisamba kwena te nomo.
Mr. Kasaka asks why should both partners be present when going for antenatal at the clinic or any health facility? Why is it important?
Okay, thank you very much, Mr. Kasaka. It's very important for both partners to be available during antenatal clinic. Maybe to start with, as we earlier alluded to, that there are a lot of investigations that we are done during the clinic, and there are a lot of information that is being given to these women and their partners. So I'll give an example where we do investigations like HIV. So you find that this woman is tested for HIV, no matter what the outcome, she may be negative or positive, but the result of this woman does not detect the result of the partner. We've seen partners, they are married for some time, but they can still have a different status. So it's very important for the two to come together so that the investigations are done together. We check like HIV tests together, the RPR tests are done together. In case there's any treatment that should be administered, it should be administered to both partners. And it always becomes a danger, especially where this woman is negative, but maybe the partner at home is positive. In the long run, because at the health facility, we won't give any intervention to this woman who is negative for preventive measures. But if the partner is positive, in the long run, she may contract the HIV and easily transmit it to the child. And these are the women who seroconvert. Status ya change. But since abena mankwe tatwa ishiba status yabo na whatever ishiba status kuti limbi after some time nimbi status yabo ili positive. So if you tule kabila sana chakweba toba pimi na chapamo to apelera information chapamo no kuishta support bwino limone mona mayo kutaba positive limba bena mankwe baba negative na cho chifwaika twaba chenchenta bose okuchingiri abala bashitata nangula bana mayo abali negative so that nabo beyambula akashishika HIV.
And by honest bachisa ipusha ti if molecule the namayo ale no wala no paper fwaka is there any damage that can be caused to the unborn child?
Twatotela sana mkwaiva NST kwena ukulingana fyene funde na mayo uli pabu kulunga fyafine twachilanda tipanti nento booking kulaba no kuipushanga bala no bwala nango bala pepa. So kupepa na fwaka kwena tatusuminishero na mayo ali pabu kulu kuti twaisayo bati kwena ngabala no kuti twasekela mabaisa no chili aba ba papa.
So that is regardless of the amount.
Mkwaiye.
Okay. All right, so if you want to come through, you can come through using the number 0965913913. Let me see if I've got some SMSs here before we revert to our questions. Okay, so this one says, Mr. Nawa, my name is Kinkar from Itengo. My question is, I want to find out, someone who is HIV positive takes alcohol. Okay, let me pick up this call. It has been flagged by... Okay, hello? 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 Okay, so we lost that particular caller. Okay, so this particular message continues and says, someone who is, okay, we've got a caller. Hello? Hello? Ashan question yenu waction bana futi mureputuka kindly move, your network is breaking.
Dera ndapata baba kashana abakwela bali pabu amalwa akwaka ansuko nakutala tabaya tomba efija bakutaba shani ngachako batapa mwa.
All right. Ishina.
Lego Christopher Mpaka.
Manani?
Na Christopher kubwana mkubwa.
Christopher. All right. Okay, so I think we can just tend to this particular message, then we get back to Christopher. So, question ati, someone who is HIV positive, I'm trying to get the gist of the message. Someone who is HIV positive and takes alcohol, does it mean when that particular individual takes alcohol? Okay, this message is again cut. I think it's the same message which was cut earlier on. Anyways, Mr. Christopher comes through and asks, someone is pregnant ale n'obwalwa ale pepe ensumuko bale n'ofuaka nga bapapa omwana kibashani. I don't know in what way in what context, but he just asked kibashani nga bapapa aba bantu abakwati bale n'obwalwa endukupepa during pregnancy.
Okay, twatotera sana ba Christopher ichakubalirapo tufire twaishiba atubwala napo ni drug nafuaka ni drug muni fuaka kwa diba very dangerous ailment yo tuita ati nicotine ila leta sana obwafya that's tulakoma insha na mayo ulipabukulu tafuire okulumbwalwa tafuire okupepa fuaka ili ngirine ngaleno sana obwalwa le pepa fuaka ila ita affect growth ya mwana uli omwana takule bwino efya lingiro okukula because of the two ubwada ila inefuaka le pepa so the yalikwata kwa ma effects especially ku mwana mumikulire so bambikula batu mwana nimbe afyaro omunono sana umubiri wabo wachepa ukuli not normal if yafuile okuba so yalikwata ma effects and tulakonkomesha shana fuaka whether ni sunko no walwa tafile fwai kwa kuli na mayo uli pabukulu kuti fyaletero bwafya kuli yena na mayo fyamuletera amafya fyaletera no mwana ushira fyalo.
All right, so Charity comes through with an SMS and says, can you determine the gender of the unborn child at 2 months when a pregnant mother goes for scan?
Thank you very much, Charity.
Yeah.
for that question. I think at 2 months it may be too early to detect the gender of the unborn child. Remember, this child is still in the developmental stages, so it may be too early to determine the danger at that the gender at that age. Yes.
Okay, so there are these issues or notions, especially makombono mutufu momo, where women express fear on. I will mention two things. Ganachirwa vanes varanshauta, and there's all these complaints, and varanshauta because maybe nadia ku registration yawe amaneses bali rude. Can you just clear the picture on this particular thing before we go to the next one?
Okay. Twatotela sana mkwai kuli bakonfa wesu kwena okukabira kwesu nga fyafine twachilanda na mayo oli wonso uli pabukulu tufwaya aisa bwangu kuchipatala pakwe bati twamulemba dili elifumo dili ono lero natwishiba kuli bamwo kula bati bacherwa okwisa mukulembesha nga bacherwa okwisa mukulembesha, let's say 5 months or 6 months. All we do as nurses is just to give them clear information on the importance of actually early booking.
Not shouting at them.
Not really, we don't shout. We just correct the situation to say next time when you come, please try by all means to come early. Of course, there are adults, maybe when they are being corrected, some people will feel offended to say they are being shouted. But what we do as nurses, we merely correct the situation because that woman has already come. So even the correction of the information is for the next pregnancy. So we usually give that information on the importance of early antenatal booking, not really shouting at them.
Then there's another skeptical notion of you to say traditional medicine can mix with ANC. Just how true or how false is it? Can traditional medicines mix with ANC? But it's a continental prescribed medicines as medical personnel. Is it advisable?
Okay, thank you so much. Actually, it's not advisable because traditional medicine is not something that is scientifically proven. We don't know the concentration, we don't know the dosage. There are a lot of things that attributes to traditional medicine. So for us as Ministry of Health, in Dollar District Health to be in particular, we don't actually advocate traditional medicine. We have seen this because most of this traditional medicine brings about bad outcomes. So we don't advocate for that.
All right. So we get to this particular item. What is the role of men in ANC? And I think this resonates with the question which I was asked by Mr. Kasaka. What is the role of men in ANC and why are they important in the process?
Okay, thank you very much. The partners and the men, they are very important in our antenatal care service deliveries. Remember, you find that men, mostly in these homes, in the communities, they are the decision makers. So when a man gets the information, they are able to get the information that we are able to give to this woman. They will be able to support. They'll also be able to encourage the woman. They'll also be able to learn about the different danger signs. Danger signs aya sangwa mo antinento kulaba sometimes ibina mayo takweta makateta alande nokulanda. But if the partner is well informed, they've learned, they know about these danger signs, they know what is expected of them, the partner will be able to come up and help this woman. So it is very important. Men actually play a very important role in encouraging these women during booking, even the entire pregnancy period, and also postnatally. So it is very important to encourage the women. Remember, there are a lot of things that are done during antenatal. One of them that we mentioned, we forgot to mention, is the prophylaxis that we give. We give the anti-malarial prophylaxis. So
okay, so we've got a caller. Sorry for cutting you short. Hi, good morning. Hello. Hello, good morning. Hello, banano ishina gware tumina mugwe.
Nebo po ndetu mina ku Mufulia Road.
Po in Mufulia Road, that's no. Okay, go ahead.
De tako question yato ba umwana kachari linga ukutena ukano akismodidimu. Ale no asio bwa do kachari ya sungo.
Okay, all right.
Okay.
All right, ati ushachari lingomwana kashi akano kureko walwa when she is pregnant. Is it okay for a woman to continue taking alcohol even when she knows that she's pregnant? Okay, so let's do this. I think this is going to be my last caller. Hello, good morning.
Yes,
we know ishina no kware tumina.
How ende tumina ko no size neo Patrick.
Patrick, go ahead.
Nde pshako mwali mu relationship no mugeozi. Wamwewo kwa tudone chumuropa akana. Batera nchali kwata po mwana. Ancho asa kwate fumukuri wowe mwaume. Pamwe kwacha pakwa kwa nchineto tukaye bonse. Awasi ashwakoro basara ndokwe bachawe ari busy face tukameba. Pero bashuka babega kwa nchineto ni shrepi urenshi.
All right, so that was our last caller, Patrick. I think we can firstly attend to Paul, who stated to say a woman who doesn't want to, put the bottle down despite being pregnant. What are the implications?
Okay, thank you so much. I think we had already explained, but we can still go through. Remember, alcohol has got its own consequences, as we mentioned. And as what we basically do at the health sector, we'll give information. And then we'll be able to give them adequate education on the disadvantages of these women actually taking alcohol. But what can be so difficult maybe for us, where we can advocate maybe the other members of the community to come in to help us, is from where the community, where the woman is staying. Because as we are the health facility, we'll give the adequate information. So when they go home, we are also encouraging the community at large to help us also on the disadvantages of women taking alcohol. So for us, we are saying alcohol is not good for a pregnant woman because of the consequences that it comes with.
Then Patrick from is it Northrise? Says I don't know if you can tackle this one. He was according to him, he was in a relationship with a female, and this particular female denied or declined to donate blood. I don't know if it was to Patrick, but he hasn't said it. He's not clear. This woman declined to donate blood. I don't know where the blood part comes in, but she fell pregnant. And when the man went to get the pregnant girlfriend to go with her for antenatal, the family of the female declined, and they took her minus him being present. And so he's asking, "Kuti washitashani hapo?" Yes, not getting into marriage counseling now.
Yeah, thank you so much. Though that one sounds like a social, a social concern. But for us, when they come at the health facility, we'll handle them as clients and be able to actually treat them accordingly. But for the social aspects also, maybe that's why we can involve the social warfare and all those people that can be able to help in the social aspects. Otherwise, when they come to us as medical personnel, we'll treat them as clients and be able to offer treatment accordingly.
Yeah, so before those particular two calls came in, you were tackling this particular last item, that is, the importance of men in, the role of men in ANC and the importance they play in the process.
Okay, so as we were saying earlier on, that men involvement is very important in antenatal services. We're saying in our communities, you find that most of the times these men are the decision makers. So the men are very important. Once they have the basic information, they'll be able to support the woman. They'll be able to know, once they have the information, they have the knowledge about the danger signs that may happen to this woman, they'll be able to take note, and they know when to take the woman to the hospital. So the men really play a very important role in antenatal services, and when the man is involved in these services, you find that even the outcome is good, because this woman will be encouraged. Remember, some women undergo a lot during pregnancy, something that may be stressful depending on the type of woman. So they need that social support, they need the psychological support, and everything else, health support is needed. So it's very important that men are involved in the care of these women.
Your concluding remarks? I will start with Mrs. Tawanda.
Okay. Thank you so much. I am sure it has been an interactive session, and we appreciate all the questions that are coming forth. And please, we encourage the community at large to help us in identifying these women that are pregnant so that they come and book antenatal early. I think those are my closing remarks. Thank you so much, listeners.
Your concluding remarks?
Okay, thank you very much. In conclusion, our main key emphasis today, Mirombaba Namayo, Vashtata, we are asking you to book early for antenatal. As soon as this woman knows that they are pregnant, please come through to our facilities so that you'll be booked and offered the various services. We also encourage our men, the partners, to be involved to improve the delivery of our services. Thank you very much.
Okay, thank you so much. I'm sure we've just been dealing with maternal and child health, but remember, we have cholera around us. So we are just reminding our listeners on the 7 cholera steps. What we are saying as Ndola District Health Office, we are saying please chlorinate and boil drinking water, hand washing before eating and after using the toilets. Let's ensure ORIS for every episode of diarrhea or vomiting. And let's ensure all the leftover foods, please, must be covered up properly and warmed before eating. And then let's ensure you wash your hands, you wash your fruits and your vegetables before eating. We are also please reminding ourselves, the community at large, report to your nearest health facility whenever you have any symptom of cholera. And then all alert others about the dangers of cholera. Thank you so much for your time.
All right, so basically that was how we have come to the end of the first episode of these particular programs brought by the Population Media Center, and this was Kuka Jackson as the host, and in the studio I had Mrs. Asamta Tawanda and Sister Barbara Lutango, and we were discussing early ANC booking. And quite frankly, we have to acknowledge our sister radio Chimwemwe 91.7 FM, as they were also live for this particular program. So this is how we come to the end. Meet us, we shall definitely mix next week same time, same frequencies, and this is how we definitely call it a wrap. Thank you so much for staying tuned. God bless.
Listen to your favorite radio show, Insaka Ya Wumi, for great information on various health issues like HIV and AIDS, sexual and gender-based violence, maternal and child health, and family planning. Ndola, listen on Chimwema Radio and Rooster FM at 1000 hours every Wednesday starting 17th of January 2024. In Kitwe, listen on Ya FM and Flavor FM every Thursday at 10 hours starting 18th January 2024. Mpongwe, listen on Pongo FM at 10:30 hours every Wednesday starting on 17th of January 2024. Mufulira, listen on Mafcan FM at 1500 hours every Saturday starting 13th of January 2024. Chingola, listen on iWave Radio and Kokoliko FM at 900 hours every Thursday starting 18th January 2024. Insaka Ya Wumi, helping us improve our lives for better health. Listen to your favorite radio show, Insaka Ya Wumi, for great information on various health issues like HIV and AIDS, sexual and gender-based violence, maternal and child health, and family planning. Ndola, listen on Chimwema Radio and Rooster FM at 1000 hours every Wednesday starting 17th of January 2024. In Kitwe, listen on Ya FM and Flavor FM every Thursday at 10 hours starting 18th January 2024. Mpongwe, listen on Pongo FM at 10:30 hours every Wednesday starting on 17th of January 2024. Mufulira, listen on Mafcan FM at 1500 hours every Saturday starting 13th of January 2024. Chingola, listen on iWave Radio and Kokoliko FM at 900 hours every Thursday starting 18th January 2024. Insaka Ya Wumi, helping us improve our lives for better health.
This message is brought to you by Population Media Center in partnership with Ministry of Health.